So we'll start the assessment with mental exam, alert and oriented ×3, patient appropriate speech, rate of speech, perception, dressed appropriately, and appropriate mood, and looks like the stated age. And then throughout the exam, I'll be inspecting the skin with each different section, checking for lesions, scarring, any discoloration, edema, and if there are any moles, checking for asymmetry, borders, color, diameter, and then elevation. And then checking the hands, checking for fingernail integrity, looking for any clubbing, discoloration, and then checking for cyanosis in the cardiovascular exam. And then head, inspection of the scalp, inspection of the hair, and then also throughout the body checking for appropriate hair distribution. Checking the scalp for any dermatitis, any dandruff, inflammation, and then checking the color of the hair. And then going into palpation, palpating scalp, looking and feeling for any masses, nodules, any tenderness, and then palpating the bones, the occipital bone, frontal, and then moving into temporal pulses, and then going down and checking the temporomandibular joint, having them open, close, listening for any clicking, feeling for any clicking, and then doing the cranial nerve, starting cranial nerve 1. Don't need to check this in office, only if there's a chief complaint of something olfactory. You can use essential oils for smell. And then cranial nerve 2, checking visual acuity with the Snellen chart, Jaeger chart, color discrimination, and checking the eyes later in the exam. And then cranial nerve 3, oculomotor 4 and 6, doing the 6 cardinal field of vision, starting midline, going up, having them follow the finger back to midline, up, and then down, and then back to midline. And then doing a convergence, so having them follow the finger in, and then cranial nerve 5, first sensory, doing ophthalmic, maxillary, sensory on both sides, making sure that they can feel it, and then mandibular on the bottom. And then the motor function, cranial nerve 5, trigeminal, having them close the jaw again, feeling the masseter muscle, and then having them move their jaw laterally to make sure that the movement is intact. And cranial nerve 7, facial expression, so having them smile, frown, puff cheeks, raise eyebrows, smile, show your teeth. And then the sensory portion of cranial nerve 7 or facial is the posterior 2/3 of the tongue, so having them do a taste test if appropriate. Cranial nerve 8, acoustic, do a whisper test, so have them close the ear, just go over on this side, and you can check bilaterally, and then whispering 1, 2, 3, and having them 1, 2, 3. Thank you. Cranial nerve 9, glossopharyngeal, so checking the integrity of the uvula, so having them say ah, and make sure it's moving appropriately. Cranial nerve 10 is vagus nerve, innervates